My name is Chen-Yuan Chiang. I'm a professor of Taipei Medical University. I'm also a consultant of the International Union Against TB Lung Disease since 2003. So I trained as a clinician. I've been teaching management of tuberculosis as well as drug-resistant tuberculosis for almost 20 years. The training course organized by the union started in 2008 in Manila. And we moved the course to Bangkok in 2010. So this training course has been conducted from 2010 to 2019 every year in Bangkok. The course includes 5 days that has, class-in-class discussion, also field visit. We include country presentations in the course. But then the training course was suspended in 2020 because of the pandemic of COVID-19. And subsequently, we decided to organize an online course. It started in 2024. We tried the first online course in November 2024, and then the second time in early 2022. This course was mainly about diagnosis and management of drug-resistant tuberculosis in the content of a national TB program. So the diagnosis and management of drug-resistant tuberculosis, is a fast-changing field. WHO has recently issued a rapid communication on the use of the BPA regimen and the BPA-M regimen. Furthermore, that stream stage 2 include 2 new regimens. One is a 9-month betaquine-containing regimen without an injectable agent, and the other is a 6-month regimen that include both betaquine and an injectable agent. Both regimens would be compared with the Bangladesh regimen that include an injectable agent without betaquine. The result of the stream stage 2 likely will be released in May 2022. Furthermore, the diagnosis also has a lot of new changes. Recently, WHO recommend a new diagnostic tool, including the ExpertMTB XDR, that can detect resistance to isoniazid, quinolone, injectable agent, and ethionamide. And these new developments would be included in this course. The course is designed for clinicians, those who are responsible for diagnosis and treatment of drug-resistant tuberculosis. It is also designed for staff of national TB programs and technical partners working in tuberculosis care and prevention. Those who may not take care of TB patients, they will need to know the clinical issues as well, so that for the programmatic management, you've got a better idea of how to deal with the challenges in the diagnosis and treatment of drug-resistant tuberculosis. The course is particularly designed for those working in low and middle income countries with limited resources. So we will take that reality into account and come up with practical solutions for countries with limited resource when they would like to implement programmatic management of drug-resistant tuberculosis. The objective of the course is to provide updated knowledge about the principle of tuberculosis care and prevention, mechanism of drug-resistant TB, also the current global epidemiological situation of drug-resistant tuberculosis, the different approaches for detection and diagnosis of drug-resistant tuberculosis, as well as the conventional drug susceptibility testing, the rapid diagnosis of drug-resistant tuberculosis, regimen design according to the different pattern of drug resistance, the detail of the drugs, including second-line and the new anti-TB drugs. Also, there are issues related to HIV infection, the children, the comorbidity, and there are challenges and solutions for PMDT, the programmatic management of drug-resistant tuberculosis. The content of the course we divide this the details of the contents into 3 weeks, 24 recorded education units, and each week we cover 8 education units, and also there are 2 live sessions per week, and we expect that the participants would complete 4 pre-recorded education units before they attend the live session. So each week there would be 8 education units, 2 live sessions. That during the live sessions, the participants may raise questions about the materials that they have gone through during the before the live sessions, and also we include country presentations and practical exercise in the live sessions. So those are the structures and the contents of the course. And the details of the course, I may briefly mention that in week 1 we speak about TB, the organism and the host. We go into the detail of the basic concept of drug-related tuberculosis, the global epidemiology of drug-related tuberculosis and contributing factors. We discuss the clinical and radiographic manifestation of TB and drug-related tuberculosis, as well as the conventional drug susceptibility testing, rapid diagnosis of drug-resistant tuberculosis. The second week, we speak about the case finding of drug-resistant tuberculosis, the treatment of new and previously treated TB, isoniazid-resistant TB, and then detail about the treatment of rifampicin-resistant TB, the long regimen, the short regimen, and then also we introduce each drugs, bedaquiline, linezolid, clofazimine, danamide, britomide, imipenem, menompenem, and also the short course chemotherapy for MDR-TB. The third week, we speak about ADSM. Obviously, that is important because the adverse reactions is quite frequent during the treatment of MDR-TB. So we have the active tuberculosis drug safety monitoring and management. We speak about the management of adverse drug reaction, management of DR-TB patients with liver disease, renal insufficiency and pregnancy. Also, issues in children and contact will be addressed. We speak about surgical interventions in the management of DR-TB. Also, we speak about care and support for patients with MDR-TB. Infection control also included. Finally, we deal with the management of drug-related tuberculosis in the era of COVID-19. We look forward to welcome you to participate in this course. Thank you.